Aotearoa, Nisambula Vinaka, Malolele, Talohani, Namaste, Bonjour, Tēnā koutou, tēnā koutou, tēnā koutou katoa. Welcome to all of you. It is a pleasure to have you all here at this moment and in this time, in this forum about generation equality, about accelerating progress to achieve gender equality, to make sure that women have the opportunity to be who they are and that they are given the chances in this society to be who they can be. The focus of today's forum is about gender equity in health. And we have 4 amazing women who are leading a lot of work in the health sector across New Zealand, across the Pacific, and globally, who have rich stories of what they've experienced personally, but also professionally. And today we are going to hear their stories, the challenges, but also the opportunities that they have had to be where they are, and how we need to work collectively to make sure that all women have the opportunity to be safe, to be healthy, and to be able to thrive and to survive for themselves, their communities, but also their children and future generations here in New Zealand, but also globally. And today, especially, we want to acknowledge Her Excellency, Mrs. Catalyse, the Ambassador of France in New Zealand, who has provided this platform, this opportunity for us women in New Zealand, women from the Pacific, to show who we are and to provide our voices, to lend our voices to this conversations here, but also globally. Merci beaucoup, Madame. I also want to acknowledge His Excellency Alfredo Perez Bravo, the Ambassador of Mexico here in New Zealand, for co-hosting this event with Her Excellency Catalyse. Some of you may know or may not know that this forum is contributing to the Global Forum, which is being held in Paris today, the 30th of June here in New Zealand, but maybe not yet in Paris, and the 1st of July, which is about generation equality. What do we need to do to accelerate progress to achieve equality and equity for all women in developed countries, but also in developing countries? Let's not forget that in New Zealand, we ourselves have our issues with regards to women not being able to access particular types of medical assistance. So let's let the panel share their thoughts today. It is them who will provide the expertise and the different lenses that will help catalyze change in this area. I want to acknowledge especially Victoria University for being so quick to adapt from an in-person event, which some of you will have known. We were planning to meet at Victoria University, but due to the changing alert levels here in Wellington, with the recent COVID case that we have had to shift very quickly to a virtual event. And so here we are today. Thank you very much, Victoria University. I also want to acknowledge particularly all our panels for availing themselves out of their very busy schedules to be here today. Thank you for your time. Last but not least, thank you to all of you who have joined us today, wherever you are, around New Zealand or around the world. Welcome. This is our moment to learn, and this is our moment to be inspired, and this is our moment to be agents of change. And I also want to acknowledge my wonderful, awesome Women Network Sisterhood who have galvanized behind this forum to make it happen. Thank you, Nairi. Thank you, Nikki. Thank you, Jessica, for all of your hard work. I will now hand over to Her Excellency, Mrs. Catalyse, to give her speech for this event. Thank you.
Yes, can you hear me? Kia ora and bonjour and good morning again, and sorry to have jumped a little bit earlier on that exercise. And I just was saying that I would like to be brief in order to leave more time to the panel and all the wonderful people taking part in this panel. And I was also saying that since Beijing, the situation is that not any country in the world has achieved equality between men and women. And so it is absolutely vital for us to ensure that the conversation carries on since the last years, and that we keep building on the legacy of the Beijing Declaration and on the platform of action of 1995 in order to stamp out the discrimination against women and achieve equality. And this is where the Forum Generation Equality comes in. 25 years after Beijing, our wish with Mexico, who is also co-chairing that event, is that international organizations, civil society, private sector, youth, movements like yours are mobilizing once again to ensure action, accountability, and to achieve tangible progress, because this is what is the more important, that we have something really concrete. So the forum opened last March in Mexico, presided by the President of Mexico City, and it's currently taking place in Paris, Loretta. It started yesterday. And until the 2nd of July, it will be organized with a series of events online, like today. Unfortunately, we had planned to organize the event in Paris, but we had, like here, to shift to a virtual exercise. But the important point is that it is widely open to civil society. I would just quote a few words said by President Macron in opening that conference, well, that forum yesterday night, in fact. He said that through Forum Generation Equality, France's objective is to state loud and clear that the rights of women and girls are universal, and as are all human rights everywhere, have to be respected everywhere, all the time. The UN Secretary General himself said that the forum was a moment to readdress global concern with activists, policymakers, and leaders across all ages, shaping our world into a more just and gender equal society. And what I would like to add, maybe in the context here of the Pacific, is that in this unprecedented pandemic of COVID-19, not only in the Pacific, but especially here and in the rest of the world, women have been strongly impacted in terms of inequalities, family violence, and economic capabilities. It's always on women that this kind of problem, unfortunately, are being raised. And therefore, it is very important, and more than ever, to acknowledge that women have a huge contribution to society. They are at the root, at the heart of society, and they have to be supported. So today, you will, Loretta, and the panel will be focusing on the healthcare sector, a very, very, very important one for women and children, because that's the continuum. That's where women are really at the heart of society. And I'm happy that we will hear from the panel of women leaders with a extensive experience in that field. So I'm sure you'll have a very, very thorough discussions. And I would, before stopping there, because again, I think it is what you will say which will be important, to thank very, very sincerely, also from the bottom of my heart, the Awesome Women network, and in particular you, Loretta. We are really very grateful for your support. Again, thank you to Victoria University. Thank you to all participants. I think you have created this space here in New Zealand to share and acknowledge the ideas that I've just mentioned. So I wish you a very good panel. And again, thank you, and thank you.
Kia ora, Madame. Thank you very much for those inspiring words and for correcting me that yes, the forum is already underway. I'm obviously working on New Zealand time. But thank you very much for those inspiring words and for opening the forum, giving that global context about the importance of us picking up the pace from the commitments that was agreed to at Beijing to where we are now. We have not made that much progress. Pick up the pace and accelerate for our girls and for our women. Thank you very much. It's now my pleasure to introduce His Excellency Alfredo Perez Bravo, who will be giving his address as to his thoughts and vision for this forum.
Kia ora, Morena, bonjour, good morning, buenos dias. I would like to thank first Loretta for the introduction and for the work you have been doing with everybody in this seminar. I, of course, would like to say thank you very much, merci beaucoup, to the Ambassador of France, Sylvain Carte-Leberg, who has been very active in this regard. Well, she's one of the most amazing diplomats I ever met in my career, but she did a wonderful job for this seminar. And I want to thank the University of Victoria for taking the lead in this very important subject for us, and of course to the speakers of this morning. Well, the Ambassador Carte-Leberg mentioned most of the important things about the seminar. Just let me add that since 1975, Mexico was leading also in this subject when we host the very important first international conference on women. Maybe you read about that. I don't think you were there because that was a long time ago and you're very young people. But 1975, by the way, was my first job in the Ministry of Foreign Affairs, was the International Conference on Women. And then we have to wait 20 years until 1995 in the Beijing conference, that was the fourth conference, to start to have guidelines in this important matter with the Beijing platform of action. But frankly speaking, as the Ambassador of France just mentioned, very few things happen, and we have to wait another 26 years until France and Mexico took the initiative to host and to organize this very important forum of generation, equality, and health. The forum has been divided into parts. The first part was already in March in Mexico City, the Forum of Mexico. And that was a very good opportunity because one of the most important things that we underline in the Forum of Mexico is that the pandemic, the COVID, create a worse situation for women, girls, and it was really something that shocked us in many regards. In Mexico forum, we have to say that it was create the momentum to mobilize the people, mobilize the organizations and the governments around this extremely important subject of women. It was a big success, the Forum of Mexico, because we have 91 government representatives of around the world, and there were 250 speakers in the forum. So we learned a lot of things. We got a lot of information. And I have to say that the main result of the Forum of Mexico was the Global Acceleration Plan for Gender. And this plan has several pillars, several areas were divided by subjects. Now in the Forum of Paris are going to be reviewed and take some actions or propose actions or lines of actions. So that's I'm very happy to hear that the forum in Paris is already there. And this is a very successful activity co-hosted by France and Mexico. Just to finish, allow me to recognize the role of France of one of the leaders countries in the world addressing this important matter. And Mexico is extremely happy to associate with France and organize this forum. And now, thanks to the big effort of the ambassador Carta Levar, we have this, for me and for us, very important seminar. So I really want to thank all the speakers this morning for taking the floor and to share with us an important thoughts. We believe, and that's the conversation we have since the beginning with the ambassador Sylvain Carlavert, that New Zealand has to play a more important role in this subject around the world. So we really invite you, we really want to see New Zealand important actors, social, economic, political actors of this country participating more in this subject. So you're very welcome, and we are very grateful with your participation and your time. Thank you very much. Merci beaucoup, and au revoir.
Thank you very much, Your Excellency, for those really kind, but also the historical context that you have provided in terms of the actions or the lack of actions that have been taken to really progress those tangible commitments that were made many, many years ago. I wasn't born in the 70s, so I am now learning about what we need to do to accelerate progress and to make things better. We're now moving into our panel session discussion, and it is my pleasure to introduce Tanya Mullane from Whetū. I'll give you a brief introduction, and then she will introduce each of our panel members. Tanya is a first-generation born Pacific New Zealander. She is of Fijian, Tongan, and Greek whakapapa. She grew up in Te Puke, rural New Zealand, and has 4 children, has very strong whakapapa to her area. She worked as a nurse with an iwi organisation, so she brings a very strong Māori lens to this kōrero. Before moving on to Plunket, where she worked as a nurse there, then she moved into academic roles at the Bay of Plenty Polytechnic, at the Wairiki Institute of Technology, at the Manukau Institute of Technology, and most recently she led the workforce development at Auckland South Corrections Facility. She is currently the program manager for the Bachelor of Nursing Pacific at Whetū, and over the last 16 years, she has graduated, this is a very significant number, over 350 Pacific nurses who have significantly contributed to the health workforce to better meet the needs of Pacific people and all communities here in New Zealand. Tanya, thank you for that. I haven't finished your introduction. I just wanted to acknowledge the number of people that you have helped to bring into the workforce. She's currently completing her PhD, looking at cultural strategies that support Māori and Pacific with diabetes to better health outcomes. In doing so, she has developed the Tangata Haurua Combined People Research Framework, which draws from kaupapa Māori and Pacific methodologies and values to uphold the rights of Indigenous Māori to have their knowledge, culture embedded in research undertaken in their lands and their whenua, whilst also giving voice to Pacific people living here in Aotearoa, New Zealand, particularly given their shared and connected whakapapa. Tanya, I am in awe of you, and I cannot wait to hear you lead this panel discussion. The floor is now yours.
Ngā mihi nui, Loretta. I'd just like to acknowledge, first of all, the awesome woman who came before me in the Bachelor of Nursing Pacific, Margaret Southwick, and others who probably graduated most of those 350, but were brave enough to be awesome women and set up a program such as this that meets the needs of Pacific and the community. And you know, I just had a thought about our roles as Pacific women in mahi and work and health, and you either have to be a favourite or a fighter. And I think the many awesome women that came before me were fighters. I don't ever tend to be the favourite, so fighter seems to fall into my lap, but I'm quite happy to do that. And those women who broke the mould and allowed us to come behind them to carry on this fantastic work. So kia ora, Loretta. I'd also like to acknowledge Aotearoa and Ngāti Toa, the tangata whenua and the mana whenua of the land and the people that we are on in Wellington and in Porirua. I'd like to acknowledge the French Embassy and the Mexican Embassy for their partnership, for them to tautoko, for them to support this kaupapa, this important event. Loretta Adnairi for having the foresight and the energy and the time and the sheer tenaciousness to get this together. I can imagine, can't even imagine what that must have encompassed. University of Waikato, Victoria, for also allowing the platform that we sit on. And the Awesome Women's Network, it's about promoting awesome women. You know, this is about the generational equity that women are striving for, women from Aotearoa, but importantly, women from the Oceania, Pacific, Moana Nui Kiwa, which we share. So we are all very different. We'll hear from our fantastic panelists how different we are, but I think the main thing is that we need to concentrate on how much we have in common. So the commonality is what what brings us here, and it allows us to talk about our experiences, our lived experiences. The first panelist I'd like to introduce, and you'll all be waiting, Anjana. I'm going to say your name is first. So I'd like to introduce Anjana. I've known Anjana since my short time here in Wellington in her role, and she has been extremely supportive and helpful to me. But Anjana is a professional doctorate candidate at Victoria University. She has 27 years clinical experience in the areas of surgical, cardiothoracic, cardiology and cardiac rehabilitation, nursing and nursing education. And she also has her current role, which is really important, especially for our Pacific and Māori workforce at Capital Coast DHB. Anjana, I would like you to pass it over to you for your kōrero and to share with others your wonderful experience. Ngā mihi nui.
Thank you, Tanya, and thank you everyone for the privilege of being here today, for being asked to be part of this panel. I was just saying earlier that it comes with a little bit of you know, humbleness, a little bit of excitement, but a little bit of anxiety as well. You know, do we want to pitch it right and we want to get it right? So thank you for allowing me to be part of the panel. So Nisambula Vinaka, as Tanya said, Anjana Naidu, currently in the role of Associate Director of Nursing Workforce Development for Capital Coast District Health Board here in Wellington. You probably have gathered that I come from Fiji, that's where I originate from, and I completed my Bachelor of Nursing degree in Australia and then returned to Fiji to work in Lautoka Hospital for 2 years, and what a journey that was. But I want to you know, situate myself and talk about my personal background and my journey, because I think it's important in the way that it has brought me to where I currently am. So I moved to Australia to complete my higher studies, and I lived with my sisters, and we were all aged between 17 and 7 years of age when we were living in Australia without our parents, because that's the way education was important. So that's where we went with our journey. It was at the time that things in Fiji were a little bit unrest, and so that was the decision that was made. For those who come from Fiji, I completed my primary and high school at Jasper Williams High School, and this may not sound important for people who are not from Fiji, but these schools are all girls' schools in Fiji, and this is where, as a female, as a woman growing up, or a youngster growing up, I learned that girls can do anything, anything that they put their minds to. This is also where I found my voice. Many would say that I could provide an opinion on just about anything. However, when you think about it, it is also called leadership abilities. So this was the foundation for me growing up around a lot of women, a lot of strong women. And you know, you're in your finding years, or as you're growing up, you're wanting to navigate the system, and you want to see who you are, and surrounded by women, strong women, educated women. It was quite remarkable, I think, and integral to my journey. So how I entered the health profession, when I lived with my grandmother for a period of time growing up, and it was my responsibility to look after her when she broke both her arms, and she was a diabetic as well, type 1 diabetic that required insulin. So it was my responsibility, and it was very at that time, very old school equipment that she used. So you had to boil her needle and her you know, syringe and all of that, and that was part of the process of giving her medication back home. So you know, I used to help her with that, not thinking that that's what I wanted to do, and nursing wasn't what I wanted to do at the time. But as I went into high school and I was completing my studies in Australia, we had you know, different people talk about their careers, and part of that career conversation was from a nurse. And I thought, gosh, I do all of these things at home. Maybe this is something I could do. So I looked a little bit more into nursing as part of them, because, you know, in my head, nurses give injections, and I was doing it at home. So maybe I could do that, and that would be my career. Anyway, it was longer than that. But one of the things that was really important growing up is that my mum always said that education was the only way that we would get out of the situation that we were in. So education was massively valued by my parents, and it hugely influenced my nursing journey and my career as well. So For me, I have a family of, I grew up in a family of 4 girls, and education provided that power to change the circumstances that we were in growing up. It provided us with choices that we may not have had, and it also provided us with opportunities, and that was really how I got started, and the main driver for entering the health profession, and I do have to thank my grandmother a lot for that. After completing my degree in Australia, I returned to Fiji, and my clinical work in Fiji gave me great foundational nursing skills in a different lot of clinical settings. So it was quite different to being in Australia and here in New Zealand. In Fiji, the matron decides which ward and which area you will practice in, depending on staffing levels, and that person decides how long you will stay in that area. So you might want to work in, say, for instance, in a surgical area, but the need at that time was ED and pediatrics. So I spent a lot of time working in emergency department in Fiji, peds. I did medical, surgical, and ICU areas as well, because you moved where the need was. And when I look at the health system in New Zealand, sometimes I wish, that's something that we could use here as well, to be moved around, but it comes with a lot of anxiety and just different health systems, I suppose. The movement around the hospital was a great opportunity to navigate the health system. It's great for meeting other nurses across the healthcare setting. You also learn to appreciate the skills and knowledge and the strengths that other nurses bring. So my perspective on this today is about a lot coming from nursing in the healthcare and about women, but also a little bit about my journey as well. Anyway, so spending a lot of time across different health settings, I learned a lot about using and sharing the limited resources that we had in Fiji, from equipment or knowledge and skills, or just the moving around. After that period in Fiji, I moved to New Zealand, and that was about 24 years ago. So in preparation for that, I had to do some counting. I thought, gosh, it doesn't feel like I've been here for that long, but it has been quite a long period. Yeah. So my areas, as Tanya alluded to, is cardiology, cardiothoracic, heart and lungs became my passion, because the hospital that I initially worked in, there was an insurance scheme in Fiji where a lot of Fijians could come to New Zealand for cardiology and cardiothoracic interventions, because those were not available in Fiji at that time. So I still got to work with a lot of my people, but in a hospital in New Zealand, and that was really helpful for me in my journey. However, when I was working clinically, I felt like I didn't know enough. Some days I felt like I didn't know anything, but so I started thinking about, okay, having a bachelor's degree probably was just the start to the journey, and I needed to learn more in order to look after my patients well, and to care for them in the technical world that was changing quite rapidly. So I started my postgraduate journey. I started with I thought what was a very difficult paper, which was pathophysiology at Massey. And at that time, not very many nurses were studying in the hospital that I certainly worked in. But I thought, okay, this would give me the things that I need in order to safely look after the patients in my care. So I continued my postgraduate journey as I wanted to also be an educator, and I realized that talking to different people, if I wanted to teach at a university or a polytechnic, I needed to have a master's qualification. So I thought, okay, well, I've started a few papers, I might as well continue with the journey. so I went to find out more about teaching roles because that's what I wanted to do. And I found that my values and beliefs aligned very closely with Whitireia, which is a tertiary education provider. And I loved the way that they supported undergraduate students in part of their journey in their nursing education. And a majority of, or there was a significant amount of Pacific nurses involved and students who were involved in part of their journey. And so it just, felt like the right fit for me. It is here that I learned so much about myself, about teaching, about equity and workforce development. And for me, creating teachable moments in practice was exciting, as it was linking theory to practice, and it was about developing the next nursing workforce and the generation. So I thought, okay, this is what I want to do forever and ever. Although I thought I went into education to just, teach about heart and lungs, because that's all I thought I knew. First, when I got to Whitireia, I learned about how to teach, how to engage a large crowd of students. And this challenged my world and my perspective about teaching and learning. And its application to the clinical environment as well. They shouldn't be so distant from each other that there's a significant gap about from what we learn and how we apply it to practice. So that became my passion and the drive between, and then the drive for, the clinical and bringing together the clinical into the classroom. So I think it is really important that you find your passion. It's important to know your values. It's important to know what drives you in your chosen area of work. And for me, that was nursing. But when these align, your passion and your values and what you're doing, it brings the best out in you and also in the service that you're providing. So it is important to me to ensure that you make all opportunities count. So knowing yourself and what value is important as part of your leadership journey as well. After Whitireia, there was an opportunity here at Capital Coast District Health Board to be a nurse lecturer for a new graduate program. And it was fairly new. They wanted somebody to come in, support the student learning, but also to embed a postgraduate education as part of the new graduate program. And that was the thing that helped me move from Whitireia to CCDHB. Whitireia is very cocooned. It was a great place to teach and grow. And but coming to CCDHB, you learned what health system is and how you fit into this. But for me, I was bringing the strengths that I had learned around teaching and education and bringing that again into the clinical area and working with the new graduates, which was quite exciting. Being here, working in a large clinical environment, you have to know what battles to fight. What Tanya said about being favorite or being a fighter really resonates. So knowing what battles to fight, and there are some things that are not fighting for, but there are others that are not negotiable. And as part of your own development, you need to choose when you need to fight and when to let things go, because that's been also part of the learning here and part of my journey. Some of what I want to talk about is the next is so what are some of the key health gender inequalities affecting Pacific communities in New Zealand. And from a health workforce perspective, because that's going to be what I'm going to talk about, the key health-related gender inequalities affecting Pacific communities that I will talk about today is health workforce, education, and leadership. So a little bit of background regarding and putting things into context. In New Zealand, health workforce forecast stated that the most significant change facing the New Zealand labour market over the next 25 years would be that many more workers will retire than they will be recruited. In addition, projections in 2006 suggested that Māori and Pacific people will make up a greater proportion of the workforce. And, you know, years later, in the recent Health and Disability System Review, which some of you might be familiar with, the same notion continues about workforce development as a key limitation in our current health and disability system, and it's in line with the worldwide trends. But New Zealand is experiencing growing clinical workforce shortages. So I'm not here to talk about recruiting nurses to CCDHB, although it might sound like that a little bit, but I am here to talk about workforce in the way that one of the recommendations of the Health and Disability System Review is that Māori health providers develop strategies to ensure that appropriate Māori workforce and the range of services to meet in health and disability needs of Māori whānau and communities, and also about increasing the provision for Māori providers to employ the Māori workforce. In the same line and similar sort of thing, our Pacific population is growing, and this needs to enhance our focus on this population of workforce. So currently at Capricorn Coast District Health Board, our population of Pacific patients do not represent the Pacific workforce that should be, that should be part of the workforce. Or if they are part of the workforce, they are not in the roles that we would like them to be, where they can make a difference to population health. So in relation to health, females make a majority of the current workforce in nursing. When I say nursing, this includes healthcare assistant, enrolled nurses, and registered nurses. And as nurses, we make a difference in the health outcomes of the population, including Māori and Pacific population. Most, if not all, published documents and research say that the workforce needs to reflect the population we serve. However, that is not a reality. So as Pacific women, are we focusing on the development of our own health, of education, and for leadership as well? You know, so it needs to start for us quite further back in the way that the young Pacific women, are they taking the right subjects at school, so that if they are choosing a career, say for instance in healthcare, they are able to get into that field if that's where they're wanting to be. Are we able to staircase education and get into the roles in health that they want? For example, we don't all have to start with a degree program, because if that's not what we're wanting to do, or the support's not there, there's opportunity to start at a level 3 NZQA course and still be part of the health workforce by completing the health and wellbeing course at level 3 and starting your journey in the health workforce around that. Or and it is a free course at the moment. So do young Pacific people know about that? That is a free course that is available to them as part of their journey. The other programs that are free at the moment as well is the enrolled nursing program that you can do at Whitireia, but you can do it at other tertiary education providers across New Zealand. It doesn't have to be just here in Wellington. And of course, there are Bachelor of Nursing programs and the BN Pacific and the BN Māori courses locally. There's scholarships awarded for these courses as well that you can be partaking in. So these are about qualifications and about workforce. And well, why are qualifications important? Are they important? Because for Ministry of Health and other organizations, they use the qualification to say that this person has achieved and report to the qualification. And under the pay equity settlement information for employees on the website, it does say that there needs to be evidence of the qualification so that you can apply for the standards to achieve, and that needs to be by an accredited organisation. So having a big picture and knowing where you are navigating and where you are going is part of the development, and sharing those resources and providing these networking platforms is so important and truly appreciative and thankful. The more we know of what is available and what we are using, the better we will be in supporting people that we meet to say, well, this is available and this is free at the moment, why don't you use this opportunity? So my take on that is challenge yourself, move out of the comfort zone to make a start, because as women and in healthcare, you can make a significant difference, and tool that with education, because it provides us with choices. And I think that you have to be in the system, in healthcare, to navigate the system and to change the system. It's hard looking from outside in and saying that there are many challenges, and there are many challenges, but if you're in the system, you can be part of the solution as well. So education will get you into the health system as part of the workforce, so that you are able to navigate the system, and sometimes not just for yourself, but for your family and whānau.
Kia ora, Anjana. Sorry to interrupt. That's your time.
Okay.
I just want to. We've got time for questions after everyone's presented. But thank you so much for your presentation. And yes, you certainly don't have to attend every fight that you're invited to, but there are some fights that you do have to attend. And certainly, as we all go along in our career, we become a bit more adaptable about deciding which one of those we're going to attend and which one we're not. We have got time, everybody, for questions after. So if you want to put some questions in the chat, I've certainly got some. And once again, Vanaka Anjana, for your presentation. I will introduce our next speaker. This is Geradine Clifford Lidstone. She is the Director of Pacific Health at the Ministry of Health, and she's worked in health and social service sector for over 20 years. Tulawhalawa Geradine, Bulavanaka, welcome, and I will hand over to you to let us know more about your experience as a Pacific woman in Aotearoa. Ngā mihi nui.
Thank you, Tanya, and thank you so much for the opportunity to talk to you all today. Firstly, I'd like to acknowledge your excellencies, the participants, but in particular, my fellow panelists, Debbie Sorensen, who joins me today. Over the past few weeks, as I've been thinking about the inequalities and challenges that women in health face, I've often thought of Debbie because when you see her in action, she's quite amazing, and she never conforms to the stereotypes, and I know that this will come at a cost to her and her whānau. So I consider it a real honour to be on the panel with her today. And thank you also, Anjana, for your contribution. So I have 15 minutes to cover the brief, and I was given around starting with my personal background, and I realised that I've now reached an age where it's quite difficult to do that in 15 minutes. However, I will attempt. And so from the outset, I think that as a Pacific woman, it is very difficult for me to separate out my gender from my ethnicity, and the experiences of gender inequality and racism go hand in hand for me. So please understand if I use these experiences interchangeably. Also, I try really hard to be my authentic self. So can I apologise in advance for any use of colourful language as I share my experiences, because I'm just a colourful person. And
when I was thinking about this, I was trying to think back to my earliest memories of being aware of my Pacificness and of my womanhood, because I think that these formative experiences really start to identify your identity and your personality. And the earliest memory I have was when my older sister and I used to walk home from school together, and I was 5, and we used to walk past this butcher who was Greek, and he would come out as we'd pass and make a big fuss over my sister, who was much finer featured than me, taken after our Australian Italian father. And he would say, "Oh, beautiful Greek girl, beautiful Greek girl." And then he'd give her a saveloy and totally ignore me. And so we'd split the saveloy on the way home, but man, did I want my own saveloy. Anyway, this would happen like 2 to 3 times a week. He'd give her a saveloy and give me nothing. And I think, what a stink guy. I've seen photos of me when I was 5, and I was pretty damn cute too. I was a cute island child, and I deserved my own saveloy. So did I feel sorry for myself? Oh, hell yes, I did feel sorry for myself, and I still feel sorry for myself. Anyway, a few months after this, one day I went to Karori Woolworths with my mother, and as I walked past the bins of lollies, and for those of you that are old enough to remember, they used to have these big bins of pick and mix lollies, and it was like Rose's chocolates that were really bright and colourful. And so while my mum was shopping, I stood there and I ate all the chocolates. I wasn't trying to hide. I just learned that no one was going to give me anything if I didn't take my chances. So much to my mum's horror, they called the police on us, and I was done for shoplifting. It must have been a terrible experience for her. So, but the point is that not only was I a cute 5-year-old, I was also full of badassery. So I was a badass 5-year-old. And so I had so many of these experiences through my early years. I think of my neighbour, Dane, who used to call me Bunga Girl from Bungaland and Nigger Girl every day. And I didn't know what a bunga or a nigger was, but I actually thought they sounded like really cool words. So until I went home and I called out to my brother and said, "Hey, Grant, nigger bunga boy." And I admired my ability to join the 2 words together. I thought that was pretty intelligent. And my parents heard and went completely nuts. And that's when I found out what it meant. So the next day, well, all I can say is poor Dane. But subconsciously, what happened is that it came clear to me that teachers, community, my peers, the students that I went to school with, they didn't really have any hope for me. And so in my schooling, I walked a very fine line of being totally disengaged and rebellious while doing enough for my parents not to find out. So, and this is kind of like the start of a splitting of a personality where you become 2 different people, and sometimes 3 or 4 different people. And it's really easy to do when you realize that people don't have much hope for you. These things is what we now know as microaggressions. And the definition of a microaggression is daily verbal, behavioral, environmental slights, whether intentional or unintentional, that communicate hostile, derogatory, or negative attitudes towards stigmatized or culturally marginalized groups. That's the definition that was on Google. Anyway, so, and I think about some of the experiences and the examples, and I remember one guy in the office saying to me, "Oh, don't read the organizational strategy, Geradine, it's far too comprehensive for someone like you." I didn't really know what someone like me was, whether it's brown or a woman, or "You speak English really well. Can your parents speak English too?" Or going to the Christmas function and someone saying to me, "Oh, the chief executives like girls like you serving them, so can you wear a black skirt and a white shirt when you come?" Or "We've got you down to do the karanga because there's no Maoris in the team." And it's like, this didn't occur to me as a microaggression. This was just life. This is just how you were treated, how you were raised. And so this is the backdrop of my entry into the health sector, which was more like a morphing rather than a conscious shift. My parents started an NGO in Puriro called Te Ao Manino Trust, and they used emotional blackmail to entice me to come and work with them, essentially they said, if you use a scholarship for Pacific people, you need to come back and give back to your community. So I took 1 year's leave without pay, and I went and worked in what was essentially a social service provider, but it morphed into a health provider through the problem gambling, family violence, and alcohol and drug services that it provided. And working in an NGO really just gives you so much depth. A lot of my peers said to me, oh, you're leaving a real job to go and work there? But it fast-tracked my confidence and my exposure because I was dealing with ministers right through to community. And you can't, that is such a huge, amazing grounding to have. So when I think now about the challenges and inequalities for Pacific women in the health system, I have to draw on my own experience as a patient. And so 7 years ago, I was diagnosed with metastatic breast cancer. And as a consequence of that, to this day, I get Herceptin intravenously every 3 weeks. And to get to that point of diagnosis, I went to the GP 3 times. I had 2 mammograms, I had 3 ultrasounds, and it took 5 months from the onset of symptoms, my first doctor's visit, to the point of diagnosis. And at that diagnosis, I was told that I had an aggressive breast cancer, that it had spread, secondary spread to my sternum, and it was now incurable. So essentially, I was given a terminal diagnosis. This is what the clinicians define as a terminal diagnosis. It can't be cured. And so, like a lot of cancer, as we know, earlier diagnosis gives you better outcomes. It's pretty hard not to be pissed off when you know you've been seeking a solution for 5 months and you get told that if you've been identified as with this illness 5 months earlier, your chances of survival would be better. And I had 2 young kids, and I was just like, life is not fair. Right through that diagnostic period, I kept being told that my risk factors were low and that I don't warrant urgent investigation because I had no history of breast cancer in the family. I had children and I had breastfed them, and my age, I was under 45. But what I now know is the only risk factor that they needed to consider to warrant urgent investigation is that I am a woman and that I am Pacific. Those are the 2 things that would have warranted urgent intervention, because the data and statistics tells us that these are really things that you need to look out for. So unfortunately, the health system is only as good as you are at advocating for yourself. And this is the reason why I think it's broken. Realizing my mortality is why I now try to really be my authentic self and to bring back together that person that split, excuse me, 2 to 3 to 4 times when I was at school, partly because this is part of my healing, but also because the full person is so much more amazing than the separated out person. I actually feel sorry for people that come across me now because of the level of, I just won't put up with shit that I used to put up with in the past. So how has COVID affected this? Well, it just exacerbates the inequities that are already there, and it compounds the multiple disadvantages that restrict access to health for women. And I can't go much further without acknowledging the Pacific Health workforce. Their response to COVID-19 has been phenomenal, and at the leading edge of that response has been some phenomenal woman. Thanks, Tanya. Pacific nurses on the front line, looking after early COVID cases who didn't go home for 4 weeks during lockdown because they lived in intergenerational households with aged parents and young children who they wanted to protect. Single Pacific mums in senior executive roles who were simultaneously leading the COVID response while supervising and homeschooling their children. Community support workers standing out in the pouring rain, doing welfare support assessments and door knocking to find people when the contact tracing system couldn't find them. These are the heroes of the COVID response. Yet the gender pay gap for Pacific women in health, my back of the envelope working out, equates to about $18,700 less per annum. So I've been at the ministry for nearly 18 months, and now I'm on to my 4th executive assistant. And when you turn over that many executive assistants in such a short period of time, you have to start asking yourself whether there's some kind of underlying pathological behavior that makes you a difficult person to work with. And I now have a very experienced EA who has worked with 1st tier and 2nd tier executives, and she is astounded at the broad nature of the work that I'm dealing with and the hours that I put in. And she says to me in her experience that the level of intensity is next level. So I'm really relieved to know that I'm not a psycho, and that the research says that a lot of women, and women of colour no less, pay this performance tax where we perform at a higher level, we manage a higher degree of complexity, and hold a huge workload for little or no return and less wages than our male counterparts. So Ministry of Education did some research into 15-year-old Pacific girls, and they looked at the top 10 careers. Number 1 on that list, nurses and midwives. This is what they want to be. Number 4 on the list, doctors. And we have to do better for them. I was recently reading an article by a woman of colour who was training to be a physician in America, and she wanted to work with her own community, and observed that they were only taught to diagnose conditions on white patients, and that the CPR mannequins are in the form of a white male, when this is not typically the form of those that need the medical intervention or the form of the woman that she would be dealing with. So noting the time, I guess what I want to say is I hope I've drawn a really compelling picture about why you would want to work in health. There's lots to fix. There's lots to contribute to, and you can make a difference. But most of all, I get to work with some of the smartest women in the country, the smartest Pacific women, and they are amazing. People like Debbie and Anjana and Tanya, who are the antitheses of these microaggressions. So I'd like to close by just saying thank you to Costa the Butcher for teaching me resilience at a young age. And I'd like to high five my 5-year-old self for eating the damn chocolates without any regard for the consequences, because I was sticking it to the man. And then finally for Julia, who asked that I do some interpretive dance. Mawhitai mole avanoa.
Nisa Bulavanaka, Geradine. And I bet those chocolates tasted really good, because the chocolates they make these days, even the roses, certainly don't taste the same. So it does take us back to those 70s, which we will acknowledge that maybe we were born then. I'd just like to also acknowledge that Anjana and Geradine I've worked closely with to support Pacific and Māori workforce since my short time here, and certainly some of those gains are already being shown in our graduates, and also future projects that are being discussed. So really exciting time with all the opportunities that have been presented for multiple reasons. So kia ora, Geradine, for sharing your life and your lived experience. Remember, everybody, you can put questions into the chat. We do have time after this, after our next speaker. Our next speaker is Debbie Sorensen, who has been instrumental in the development of Pacific health sector in Aotearoa and the region. She has demonstrated leadership through her appointment to a number of key roles, which have been described as firsts. She's been the first Chief Advisor Pacific Health at the Ministry of Health, the first General Manager of Pacific Health at Counties Manukau District Health Board, and the first CEO of the Pacific Whānau Order Commissioning Agency for Pacific Families in Aotearoa. Significant roles, Debbie, you bring with you a real legacy, and who better to talk about you than you and share with us your experiences. Malo Pito, Debbie, I'll hand over to you.
Kia ora tātou, malolo malie, bonjour and buenos dias, Your Excellencies. Can I recognise my sister panellists, Loretta and Nairi, for the kind and generous invitation. And Geradine, you're way too kind to me, and we have way too much fun in a sector that is often full of too much pain. I wanted to start really talking about, 40 years ago, I graduated as a nurse. And they were obviously much shorter years because I'm really not that old. Well, I don't feel that old. And I didn't have any lifelong burning desire to care for people. The truth was I didn't have a job and I needed to leave home. And so becoming an old-fashioned nurse meant that I moved into a nursing home. It meant I had a roof over my head and I got fed 3 meals a day when I was working. And I had colleagues and friends that became lifelong friends while I learnt my trade hands-on in the wards and were taken out, for 3 months at a time to do our academic training. Those days were very interesting, and my first real experience of overt racism and overt sexism. One of the bosses in the hospital was a male nurse, and he was a charge nurse. And he told me on my very first 3 months that I was there that he liked the way that I walked, and therefore I would get a good mark for my clinical placement. I was incredibly grateful for the good mark, but I was really offended by the way that I walked, and I wasn't quite sure whether he meant that was a good thing or it was a bad thing, and I was forever confused by that. I was young. I remembered then that it wasn't a good thing to be a Pacific woman, and in fact, I worked with a Pacific nurse, and we never discussed being Pacific women. We never referred to our ethnicity or our background. We just wanted to blend in. We wanted to be like everyone else. And it was many years later that I became brave enough to stand up and say who I was and where I came from, and to hold that proudly. It wasn't okay to be brown. It was seen that you weren't good enough. And many, many times in my career in the health sector over 40 years, I heard managers, clinical leaders, health sector bosses, ministers, talk about Pacific doctors, Pacific nurses, Pacific health workers as being second class, as not being good enough, and as not to be deserving of being in the workforce. It's a real tough gig, health. It's a real tough gig. So I started off, as a nurse that needed a job, and I remember standing in a ward with 30 men. I'm a psychiatric nurse by trade. And I remember standing in the showers and thinking, my father won't like this, that I'm standing in the showers with 30 naked men in the morning. And I'm thinking, I better not tell Dad. My father was really unhappy that I became a nurse. He wanted me to do a nice clean job, like be a teacher or work in a bank. He thought that putting hands on people was below my status. I don't know what he thought my status was, but certainly he would have been horrified if he'd heard the story about 30 naked men when I was 19 years old. As I moved through my career, I became really passionate about disparities, and every day I saw how badly our families were treated in the hospital. I was often called out at night, and I was called away from my day job as a nurse because a family somewhere in a hospital needed someone to help them navigate. Often that meant that I had to advocate for things that we shouldn't have to fight for. Things like, I want to stay with my father overnight who's been admitted to hospital. Why do we have to fight a health system about that? Who gets to choose how many of us are in a room? Who gets to choose how we die? Well, we do. And I learned then that we needed strong voices around us, and we needed people who were fearless. Those battles take a toll. They took a personal toll on my life, and they took a personal toll on my family. But what I learned was we had to fight really hard, and I was pleased to have fought that battle. And I look now and things have changed somewhat. Only last week I was in Auckland Hospital with my 89-year-old mother, And as I walked into the room in the emergency department, there was a lovely young New Zealand-born Indian physician, lovely young woman. And she was sitting relaxed on the bed and she was chatting to Mum. And when I walked in, she introduced herself to me, both by name and by position, not I'm one of the doctors, or totally ignoring me, which had been common practice for many years. And she talked to my mother like she was a person, like she cared about her, like she understood that my mother lives in a bubble with 11 of us, with an additional 4 dogs and Death Row Daisy, the cat that refuses to die, a bit like Mum. And she understood that we were a collective, that it wasn't a conversation just with my mother about her care, but it was a conversation with all of us. And so that's how health has changed. But in order for that to change, we need to have people in our workforce who are able to articulate the context in which we live, who are able to talk about how things need to change and to interpret that context. Even better, we need our own people in the workforce. And I have to say, over 40 years, not much has changed. If you look across the health sector, we have one Pacific CEO, we have one Pacific chair of a board, we have one tier 2 health sector manager, and that's about it. That is shameful, absolutely shameful. And so what I would say to the health sector is, you've had your chance, it's now our chance. We should be determining our own solutions. We can craft our solutions, we can grow our workforce, and we surely couldn't do a worse job than has been done for us for the last 40 years. So it's now our time. If it's going to be our time, then we need to step up. We need to be really clear about the inequities. Pacific women are paid 26% less than men. In my roles, I have often been the only woman. I have worked alongside men and spent quite a lot of my time making them look good. And I'm paid 26% and in fact substantially more than that, less than most men in a similar role. Pacific women in New Zealand's public service are the lowest paid workers. Why is that okay? And why is it okay that people think that publishing those results actually fixes something when there's no action after that? As Pacific women, we live 6 years less than non-Pacific women. 50% of our young women who are pregnant are not enrolled with a midwife and they turn up late. We're more likely to suffer from postnatal depression and we're most likely to die from cancer. We're more likely to die from stroke and chronic lung disease, and we eat less fruit and vegetables and exercise less. And I've got to say, we drink more and smoke more. This isn't just a list of statistics, this is real for me. My mother is 90. I will not live as long as her because I'm a Pacific woman. I will not live to see my great-grandchildren grow up and get married like my mother is. I will not see that just because I'm a Pacific woman. That's really, really disturbing to me. And as I have 4 generations who live in my household with me, I desperately want my daughters, my daughter-in-laws, and my granddaughters to actually live a longer and better life. When I think about what we need to do about that, we need to be fearless. We need to lead by example, and we need to take every opportunity to work alongside other Pacific women and rise them up. It's not about what we do for us, it's what we can do for our sisters. And in everywhere I look, there's always an opportunity. In my own organisation, in the last 12 months, we've increased our Pacific women board members, and we have 22 governors across all our companies, from 14% of our board members to 66%. It's intentional. We intend to have more women running our organisation, and we intend to support them into leadership roles. You know, with due respect to the incredible men that I work alongside, it's our time too. And we need to be active in making that happen. It won't happen by chance. I've been very pleased in the organisation to make changes so that families come first, and that our young women who have young children no longer feel guilty about needing to come in late after they drop their kids off go home early and pick them up from preschool, and take their parents and their sisters to medical appointments. This is our life. We can work and have a life as well, and we need to be consistent with our values and with the way that we operate. I can do that because I'm the CEO, and I have very little patience for people who talk about all the things that are wrong when in their sphere of influence, in their ability to impact, you can make lots of changes. You don't need someone's permission to do that. And as we step up and into leadership roles, we should be able to do all of that. We need to shine a light on our young talent. And I particularly recognize Asina, who is on this conference call today. And as she starts her career with foreign affairs, I look forward to watching her bright star shine. But we need to shine a light on our young talent, on our young women. At every opportunity, we need to give them a hand up. We need to work alongside them. We need to provide opportunities and be absolutely aggressive about that. We recognized about 10 years ago in our organisation that the young men were actually getting paid more. We knew that because we actually looked at it, and now every year we review all our salaries and we check that we are paying our women the same as our men. It's really important that we actually check ourselves. I thought we were pretty slick, but it's not true. Young Pacific men are much more aggressive at negotiating their salaries and at getting a better deal than women are. And so we need to actively intervene to make that happen. A couple of years ago, we started sending our women to Harvard. Previously, only men got to go to Harvard, and it was a real pleasure for us to be in the presence of Professor Amy Cuddy at Harvard. And as I reflected on that photo this week, 3 Pacific women, plus myself, standing alongside Amy Cuddy in Harvard was kind of breathtaking, really. We all have an opportunity to do better. We all have an opportunity to step forward. We can't continue to make the excuse that our culture is respectful, and so we shouldn't say anything, we shouldn't stand up, we shouldn't be counted. Our culture is proud. We are warriors, we are navigators. We survive and we're fantastic. And we need to step forward at every opportunity, and we shouldn't be shy about that. We need to teach our young women that not only can they be excellent at anything they want to be, but their superpower is their Pacificness, their language, their culture, their values, and their family. When I think about the challenges, you know, the challenges of racism, which have been talked about here, but also cost to families and cost to self. In the course of my career, I've lost a son through drink driving. I got up and 2 weeks later came back to work. I've had a number of health challenges and never paid much attention to them, just been very grateful that the next day I was alive. And less than 12 months ago, I actually died. But here we are, God sent me back, obviously not good enough, and was rejected for another go-round. My final advice to young women is this. I'm a really great reader, like many of you, and I really love Brené Brown. I love her courage. And this is from something that Brené Brown wrote. There is no greater threat to the critics and cynics and fearmongers than those of us who are willing to fall because we have learned how to rise. With skinned knees and bruised hearts, we choose owning our stories of struggle over hiding, over hustling, over pretending. When we deny our stories, they define us. When we run from struggle, we are never free. So we turn toward truth and we look it in the eye. We indeed look it in the eye. We will not be characters in our stories, not villains, not victims, not even heroes. We are the authors of our lives. We write our own daring endings. We craft love from heartbreak, compassion from shame, grace from disappointment, and courage from failure. Showing up is our superpower. Story is our way home. Truth is our song. We are the brave and brokenhearted. We are rising strong. This to me really resonates as a Pacific woman. And I thank you so much for the opportunity to speak with you today. Malo pito.
Malo pito, Debbie. Thank you so much for sharing your experiences and also some of the examples of how you've affected change. That's Debbie was the last speaker. We do have some time to take some questions. To start off, I do have a question for the three of you. The question I have got is from each of your respective perspectives, how have you been able to affect change in your roles that you've seen some results with? Geradine, shall I ask you to go first?
Sure, thanks. I'll try and be quick to give the others an opportunity. I think it's recognising that you don't hold all the expertise. It's very Pacific and very woman to be collective in your nature and your thinking. And so for me, it is about making sure that I call on my broader networks and access the skills and experience that sit in the wider collective of Pacific women and Pacific health. Thank you.
Manaka. Anjana?
I agree. I think it's networking and getting all your networks to help you work with the workforce development for us. So partnering with the tertiary education has been quite significant for us in developing the Māori and Pacific nurses coming in, into the workforce. It's been important.
Anjana?
I think it's being at the table. I think it's all of that. Our collectiveness is a real strength for us, but we need to be at the table. We need to be where decisions are made, and we need to follow the money. That's the biggest impact that I've seen.
At the end of the day, a question for three of you again. At the end of the day, in this changing environment and health and education and all the reforms going on, how important is it that women who are Pacific or Pacific women are at the forefront of decision making and being at the table?
I'll go. Very important. You have to be part of the. Sorry, can you hear me? To be part of the decision making to influence the change. That's really important. But also, it's about our ability to articulate the strengths that we bring. That's really important. I think as well to make the change. Yeah.
Debbie, you've got a lot of experience in this area. Did you want to go next?
Thanks, Geradine. I think the first thing is that we need to use our collectiveness and we need to exercise our voice. And the health reforms, regardless of all the stats, everyone knows them. Like, there's nothing new about this. But we have been overlooked. We're often tacked on to the end of a sentence. We collectively need to come together as a health sector. We need to stand up and we need to put pressure on. Unless I'm mistaken, we all pay our taxes. So we have the right to have a say in the health system. And it's for us to design what those solutions are. It's not for other people anymore to be telling us how to look after our people.
Yes, I agree. And I just to add to that, we definitely need women around that table, but it can't be your only strategy. If that's your only strategy, because at the end of the day, and I can see that Melly Wink's on line, I'm hoping that she will agree with me here, is that you're one voice, and quite often that voice can be voted down by the majority. Yeah. So if that's your only strategy, then you need to really think hard about how else you might approach the problems.
As the collective term of Pacific is unique to Aotearoa, what's for those who may not be familiar with it, what's our point of difference as Pacific Wahine Toa in Aotearoa? What does that mean and what does that look like?
Go, Geradine.
It's funny how we've got this whole group, but I'm looking at Debbie like, you go, and she's looking at me like, you go. I'm going to defer to Debbie first.
You're making me feel really old. you know, Pacific has been a convenient kind of collection. We need to make it clear to people that it's an artificial kind of thing. You know, there is no Pacific. There's no country called Pacific. We're not Pacific. You know, I'm a Tongan woman, actually. I use Pacific as part of a collective approach so that we can come together and get numbers really to make an impact and make a difference. But at the end of the day, we need to encourage, I think, particularly our young women to be really comfortable in who they are and whatever parts they bring to that. I think there's been, you know, considerable bias inside the community around whether you're a real Pacific person or you're not, whether you really speak a language or you're not. And I think that does a disservice to our collective group. We all bring our unique superpower. And so I think Pacific is used for me, from my perspective, outside of my community, of my family, you know, of my island, of my village. And it's a term of convenience.
I agree with Debbie, and you know, sometimes from a data perspective as well, when you look at the group collectively, you don't actually understand what the underlying insights might be, and so to respond may mean that you deliver things that aren't entirely appropriate, because Tongans do behave differently from Samoans and Cook Islanders, and so you know, taking ethnic specific approaches is often what is needed to be more effective.
Hello for Geradine. For those who are listening, you're welcome to add some questions in the chat. While we're waiting for some questions, I've got one last question. If you could sit with the main decision makers from each of you, what are some key things that advice you would give that we could then see that could positively contribute to our Pacific well-being, increase in outcomes, you know, in all areas? What's the advice you'd give to those people who had the decision making or held the purse strings?
And I'm in a position which is very privileged, where I actually do provide this advice, whether they want it or not. And my advice is that this is our time, this is our season. We are now in a position as a community to make decisions and to navigate our own pathway, and we need to be provided the opportunity to do that. What that requires is a giving up of power, a sharing of power, and a sharing of resources. And we will continue to make noise until that happens.
I agree with Debbie once again. I think where we've been most effective, and what we need to do, is we need to collapse some of the traditional boundaries that prevent us from working in Pacific models of care. And Debbie covered some of this in her talk, and I covered a little bit of it in mine, where the expertise doesn't have to sit with the government agency, and you have to give up some of the power.
Geradine. Anjana?
I agree with both of, you know, with Debbie and Geradine. We have to come up with our own solutions. You know, we do know what the disparities are, and we've talked about it for so long, but we are the solution as well. We have to come up with a solution because otherwise the solutions that have come up previously aren't working for us. So it is our opportunity to raise up and say, these are the things that are not working, because that's important, but the solutions to that are equally important.
Well, kia ora everybody. That comes to the end of our presenter session and question and answers. Loretta, I'll hand back to you. Once again, thank you for the opportunity to be part of this, but also be able to host a fantastic lineup of speakers. Manaka.
Kia ora, malo Aupito, me taki maata, Tanya, and our wonderful esteemed panelist. I do have one question, panelist, that has come through from one of our long-standing awesome women supporter, Melly Went, and she has asked, can the everyday person in society do things to help improve, increase gender equity and health? What are those things? Can I start with Geradine? I know she keeps deferring to Debbie.
Debbie thinks it's because of her age, but it's not. It's because of her wealth of experience. She definitely doesn't look aged in any way. Yeah, so I think, you know, I hear this week in particular the term wokeism being thrown around like it's a negative thing. But I think in the first instance, the everyday person can read up on what the issues are. Next week, there is a document being released from the Health Quality Safety Commission called Bula Sautu. In that is a terrible account of the health status of Pacific peoples in New Zealand. It's nothing that we don't already know, but I would encourage you to have a read of this document if you're just, if you're an everyday person that doesn't really feel confident that you've got a handle on what some of the Pacific health issues are. This document will give you a really good starting point. Whawhitai, Loretta.
Debbie, any more pearls of wisdoms to come?
For the everyday person, I think there are two things that are really important. Encourage young women and support young women to do science at school. It's really important for the health sector. And the second thing is give people jobs. Jobs are the single way that we can improve health outcomes by improving, you know, prosperity and family. And so if the everyday person had an opportunity to do that in whatever form, whether that's sitting beside a woman and helping her do her CV, whether it's talking to a young woman and encouraging her to do science, or talking to our babies at preschool and getting them to count and write, all those things make a difference.
Wonderful. Thank you very much, Debbie. I know we are way over time. My colleagues are telling me to hurry along because there is an interactive session that is coming after this before I wrap up. But there is one question that I think would be worth the panelists giving their brief responses to, and just to let our audiences know, if there are still questions coming through, we will collect them and provide some answers and circulate them out. The question is, with the investment in health research and development, i.e. the Health Research Council, focused on improving outcomes for Pacific peoples, how can these studies be better utilised in mainstreaming multiple options?
I'm not sure what mainstreaming means because I don't feel like I'm in the mainstream. My experience of watching the Health Research Council function is that it kind of comes a bit in waves. But what I would say is that they seldom use their whole allocation for Pacific research, first point. Second point, a lot of Pacific research that is done is not focused on the issues that need to be addressed, which allows us a better understanding of what interventions work. And so I think focusing on impact, how can we measure impact and what makes a difference, I think would be a really good investment for the future.
Maloa Pito Debbie, Geradine.
I'm just kind of pulling together a number of the responses, so apologies if this comes across a little bit muddled. I know that the specific question is about health research, but often we just look at one aspect and ask, how is this going to solve health? But actually we need to look at the system in its entirety and how all the elements come together to solve the issue of Pacific health, of which research is one very, very important part. So I just wanted to make that distinction. And I guess using it and listening to it is really important. It's probably the most important, because often when I've seen research done on Pacific people and it goes to a mainstream agency, and I think particularly of one that I saw, one I had experience with, the Health Promotion Agency, when information from the community was given to them in the way of research, they said, oh, we can't do that. That's terrible. No, there's absolutely no way that we can do that. And yeah, so needs to be heard.
Thank you, Geradine. And Jana?
I agree with both of those. We look at the research and then we try to fit it into the system and not making changes that is recommended from that research because it doesn't fit the mainstream. Therefore, we cannot do, so we'll park it because it's not applicable now. Whereas what probably the recommendations are saying is that the system is not meeting the needs, but we're not changing the system to do that.
And Tanya, I know you've been moderating, but I'm going to take over the moderation for you so you can provide a response.
Ka pai. Well, workforce development is something I'm really passionate about, and I think that's a huge opportunity to transform and to build that cultural capital and cultural confidence, especially in our non-Pacific colleagues and peers. So if the research is related to that, how can we bridge over to our non-Pacific? I get a strong sense a lot of our non-Pacific want to do something and they want to support our kaupapa. A lot of the time they don't know what to do, so they do nothing. So if we can somehow infiltrate the workforce development, give it to them in a way that is understood, so they're able to apply it, and that would be able to. We need all the help we can. As Pacific to support better outcomes. We can't do it by ourselves. So the more champions we have along beside us and behind us, that will certainly support the cause. Kia ora.
Kia ora. Thank you, Tanya. I've got two more questions. I will wrap them into one because they're interrelated. What are the strategies that can be used to influence more Pacifica youths and to be involved in the health sector? And what is one quality you look for in Pacific women leaders that you would encourage to bring out?
I'll start. I'll start with what's the quality. The quality for me is courage. I think you need to have courage and kindness. Those two things I think go a long way in a leadership journey and enables you to step up. In terms of young people, I think we need to provide young people with the confidence that they bring value. They don't have to have all the skills, they don't have to have all of the papers and the letters behind their name, but anything is possible. I'm a living example of that. I left school at 15 and I run a $53 million whanawara commissioning organisation. Anything is possible. And I think we need to give our young people the opportunity and the confidence that they can be anything they want to be. There's a job for everyone in the health sector. Malo pito.
Malo pito, Debbie, thank you. Geradine.
So there are wonderful examples out in the sector where youth have been engaged, and I'm thinking of Youth Quake at Capital Coast, where, for a lot of our Pacific young people, we are smart and we are clever, but we fail in the system. And I just, was really on that fine line. I was really lucky, and by the sounds of things, Debbie too was lucky. Engaging them in co-design processes, if they haven't come through a traditional academic pathway, is a really good way of encouraging young people to harness their natural talent and for that talent to be recognised. So in terms of the quality, I don't think the quality of our young people is phenomenal. It's just that it's not seen. They're invisible. And so on that note, I just wanted to challenge Tanya, for non-Pacific people that want to do something and don't know what to do and so therefore do nothing, that's totally inappropriate. You should not do nothing. We don't have the luxury of doing nothing. So politely, I'd like to challenge that. If you're non-Pacific and you don't know what to do, please go and read something.
Wonderful, Geradine. Tanya?
Oh, kia ora, Geradine. I agree, and that's where I think workforce development can play a big part. to support or to challenge that doing nothing, because it certainly isn't acceptable. I think that the qualities that we're looking for is a high resilience, high adaptability, and a strong sense of self-identity, or the willingness to continue that journey of self-identity. So certainly as a Pacific wahine in Aotearoa, you do need to be resilient and adaptable. As we know, you can see by the environment, times are changing, and you need to be able to seek where those opportunities are, and make the best of them. But also not only, of course, for yourself, but looking for those who stand behind you, that have supported you, your community and your whānau. Kia ora.
Kia ora. And Jana.
Yeah, I agree with all those. Sorry, agree with all of those as well. Exposure into what health offers is really good, and some initiatives that are already being done by the DHBs around is exposing them much earlier so that they are choosing the right subjects at school. So much earlier in the piece would, entice them to say, okay, this is what I can offer as well. Do agree. Knowing yourself as a quality is part of that, because that is what you bring to wherever you're going to work.
Vinaka and Jana, thank you all very much again, our wonderful, esteemed, knowledgeable panel. You have inspired me. You have given me more fire in my belly. We have one more interactive session. Please don't go away. I've got Rajna Anderson waiting in the wing from Victoria University, who is going to lead the interactive online session. And then I will come back again. Don't go, because we've got some beautiful specially made gifts from some of our awesome women, which we will personally deliver to you, because you've got to see it to believe it. And also I'll conclude with some parting words based on everything that you guys have said, and a call to action to take something away to do after you leave this forum. Rajna, it's all yours now.
Kia ora koutou. Thank you very much. I am a volunteer for this event. I'm getting my PhD in health at Victoria, so that's my connection. This is actually something for you all to do on your own. You will be receiving a survey, and this is in lieu of a group activity that we had planned to do at the in-person event. But this survey, it's short, it's simple, but I really would encourage you to participate and to give your 2 cents. And it really follows very much from what you all have been asking about, the participants and the conversations that have taken place, which is around what can we do, what actions can we take collectively, individually, to address gender equity in New Zealand and beyond, in different sectors, health and other areas. So if you could please take a few minutes to respond to that survey. There will be additional opportunities to see the results of that survey and engagement in the Awesome Women's Network online Facebook presence. So you will receive that survey as soon as this is completed.
Thank you very much, Rajna and the team at Victoria University. You have been wonderful in terms of all of the support you've been providing behind the scenes. Well, this brings us to the end of this inspiring forum. I would like to acknowledge Mrs. Catalyse, Her Excellency, the Ambassador of France to New Zealand, and also to the Cook Islands and Samoa, for giving us this platform to tell our stories, to hear about your experiences, our panelists, and also to hear the actions that we need to do as a collective. I would like to thank Stefan Ray, Lissay Bulged, Elric Oblant, Arnold, oh, there you go, hello, they've just popped up, they've been hiding behind the scene, Arnold Esteter and Morale Bourne. Please forgive me for my very appalling pronunciation, but thank you to our friends at the French Embassy for this wonderful opportunity. Merci beaucoup for your support and for partnering with us. Thank you also to Your Excellency, Alfredo Perez Bravo. Thank you for your presence. Thank you for your kind words this earlier today. I'm sure we will see you soon. I will see you soon because I'll come to deliver your present. And again, massive thank you to the Victoria University that's been led by Lindsay Richards and Rajna Anderson and their team for the hosting facilities, for the technology support, and for enabling us to transition so seamlessly from an in-person event to this virtual platform as we continue to live in this COVID era. I would especially like to thank you to our esteemed panelists, Geradine, Clifford, Lidstone, Whawhetate Lava, Tanya Mullane, kia ora, Debbie Sorensen, Maloa Pito, Anjana Naidu, Winaka Vakalevu. Thank you, me taki maata, merci beaucoup for all that you have shared, for sharing your truth, your power, your stories, and for inspiring us and the next generation to own who we are and to embrace all that we are as Pacifica, as women, as change agents for this world. Thank you for the work that you're doing in the health sector, and we continue to support you, and we continue to give you all the aroha from wherever we are to arm you as you go out into the workforce to fight the battles that you need to fight, but to also care for your own health and well-being. Thank you for your bravery in sharing some of the challenges that you've faced personally. Geradine, you inspire me. I won't cry. Debbie, likewise, thank you for sharing your health challenges earlier this year. You know, life is precious, so let's not be too fickle about it, but let's care for ourselves and our families. And you know, you all talked about the power of the collective. Former head of state of Samoa once said, "We are not individuals. We are part of our families, our communities, our nations, our world. We are part of the cosmos." So the collectiveness that you speak of is how we are, and it's how we need to be going forward. So I, myself, and members of the Awesome Women Network will bring to you one of these with these on the side. And for your excellency, Alfredo, we've got this one, which is, it says, "Thank you, awesome woman. Thank you, he for she champion." Stefan, you're getting one as well because you've been amazing. Alongside these bouquets. So these were specially made for us by Heather Carrigan of Flax and Fibre in Dargaville, New Zealand. The cups were made by Stella Vine of Stella Creations in Te Tahi Bay here in Aotearoa, Wellington. And last but not least, thank you to all our participants for joining us, for your time. And also I would like to thank especially my Awesome Women Network sisterhood, Nairi Raikambula, for stepping up and leading this while I had just had a baby. Strongly supported by our sisters Nikki Verbeet and Jessica Roche. Now we do this, some of you may or may not know, on top of our day jobs. We do this because we love it. We do it because it's our passion. We do it because this is an opportunity for us to inspire the next generation of girls and women. Thank you, my Awesome Women Network sisters, for stepping up and stepping into this momentous event to make it happen, for living our values of the sisterhood, and for working together with all of these amazing wahine tours who have spoken today and the embassies to strengthen the sisterhood for awesomeness and to bring together this forum for a better, fairer, equal and more just world for girls. And as Dame Sylvia Cadlavia mentioned earlier, this is part of New Zealand's contribution to the Generation Equality Global Forum, which is currently being held in Paris. So it is wonderful that our voices from the bottom of the world and Aotearoa, New Zealand, in the Pacific can be amplified globally as a catalyst of conversation. Thank Thank you all for joining us. I hope you have been inspired as much as I have been inspired by the stories that you have heard from each of our panelists. And I hope that each of you will be taking away a specific concrete action for you to do as you leave this forum. I'd leave you with this quote from Mother Teresa, who once said, "I alone cannot change the world, but I can cast out a stone and create many ripples." Let us create many ripples from this event, ripples of change, ripples that will affect a positive future for girls and women in New Zealand, in the Pacific, and all around the world. Naka level, whawhetai te lava, kia ora koutou katoa, maloa pito, mausi piku. Have a wonderful and lovely day to you all. And we will be in touch to collect your details so we can come and drop you your personal gifts when are available. Thank you once again, everybody. Take very good care of yourselves.